Epilepsy is usually treated with medication. Once the patient comes in having had an event and we decide that this is a seizure, we would investigate by doing a procedure called an EEG or an electroencephalogram, and this looks at the brainwave activity and tells us whether there are seizures present in the brainwaves and where these seizure activities are coming from. Having decided that the patient has seizures and has epilepsy, medication is usually the first line treatment. And there are several medications that can be used to treat epilepsy depending on the type of seizure that the patient has. These medications need to be taken on a daily basis, usually twice a day. And in order to control the seizures, the medication needs to be taken on a continuous basis. There are other treatment modalities that can be available. We usually start with one medication, and if the seizures are not well controlled, we may need to use a second medication. And for those patients whose seizures are very difficult to control, sometimes we may need to investigate them to see if there's an area in the brain that's abnormal that might lend itself to have a surgery and having surgical removal of that area of the brain to control epilepsy. Sometimes there are also special diets that some children are put on if they're having seizures that are very difficult to control. We call that the ketogenic diet. It's a high-fat diet. But those would be the main modalities that are used to control seizures.